And then we'll go over, once they get the computer started, we'll go over like how we document like the bone in Epic for us circulators. So this is kind of a review. Some who were already here on Saturday for that neuro day, we did go over bone flaps, but I was already planning on going over this anyways. So bone flap, storage of bone flaps is when a surgeon says, okay, we're doing a craniectomy, we're removing part of the skull, and we're gonna keep it and save it in our OR freezer, which is out in clean storage. Just a fun fact, skulls can last in the freezer for up to 5 years. At that point, I reach out to the surgeon, I say it's been about 5 years, and most likely we will dispose of it. This is a synthetic one. Sometimes we'll put synthetic bones back on a patient, so this is good for our teaching here. So let's just say Eric and I are working together with Dr. Rourke, and he says, okay, we're gonna save the bone in the freezer. So what I would do to help out Eric is I would open up paper drapes for him, because that's what we're gonna wrap the bone in, if we didn't use it already. You're gonna have a sterile Ziploc bag, which Eric will show you. These live in equipment storage. I have some in 17, I have some in our bone flap block, so they're all over the place. You can find them. As well as a marking pen, which we'll use here in a second. And one thing to help out Eric too, is when he wraps the bone, we have to document who the patient is on our labels here. So for Eric, as he's operating, right, the patient label is so small, and I'll try to tape it somewhere for him, but he's like squinting, he can't really see it. At the same time, he's trying to help out Dr. Rourke. So what I like to do is I like to write in big fat letters the patient name and the MRN number. And I will confirm with Eric too, with the computer, that I am writing him the correct MRN. So I'll tape this somewhere for Eric to see, so as he's working and trying to wrap the bone, he can see the name and the MRN very clearly. All right, so another thing too is when a skull is removed off of the patient, a lot of the times there's like muscle, there's tendon, there's all this gunk that's on the bone, and usually the surgeons will request for us to clean it. So in our crani boats, we have something called a periosteal, anything that you can do to kind of clean and scrape off that muscle before wrapping it. So you'll see Eric kind of like doing this, trying to clean it up. And at the same time, I'm getting ready to call for my bone flap log, because any bone that gets stored into the freezer, it needs to be written on this form here. All right, so Eric is going to show you. So just pretend Eric is sterile. So like I said, the Ziploc bag will be sterile, which I will give to Eric, as well as our paper drapes. And also when the bone is stored on the back table, that's surgeon discretion. They may want you to soak it in antibiotic irrigation, they may want you to soak it in betadine before we sterilely wrap it and put it in our freezer. So of course, right now what Eric is doing is he's writing all on those little labels that you get with your marking pen. It's gonna say John Smith, MRN, John Smith, because he's gonna use these to wrap the bone in.
I'm gonna make like 4 labels up, and I'll put a couple on each one. So I'm gonna clean it with this periosteal, and I'm gonna clean it off. Sometimes I might use the rounded one to kind of clean the inside out. And we got 2 of these papers, so I'm gonna drape it twice. Alright. So I'm gonna clean the bone off with periosteum, and then when I've cleaned it, I'm gonna start wrapping it up. I got 2 of these paper drapes, so I'm gonna usually stick it kind of off to the side like this, and I'll kind of wrap it.
And the best thing that we want to do is remove any excess air. You want to make it as tight as possible.
Then I keep it tight. And I'm gonna kind of fold these in like this. And then if I have extra labels, I will kind of use the label, just kind of hold this together. It can be blank labels. And I'm going to put 1 of these or 2 of these patient labels on this part, and then I'm going to wrap it again with the other one.
So as you can see here, I know it's kind of hard to see, but he did write John Smith and then whatever MRN number it is. Heaven forbid we open up a bone flap that we removed from the freezer and the outside bag says John Smith and then the inside says Jane Doe. I've never seen that happen, but this is just to double check that we have the correct bone with us. So again, he's removing all excess air. He's making sure it's nice and tight. And then again, he's going to use patient labels to keep the paper drape from opening up.
When you do a cranioplasty, do you just take the outer?
So I'll go through that in a second, yeah. Now, there's no rush to get this done. Sometimes, you know, we could get it done during the procedure, or sometimes, me personally, I've waited till we were done and the patient was out of the room and I folded it. We'd rather you do it correctly to make sure that, you know, eventually if this does go back on the patient, we reduce the risk of any infection and the excess air. So with his sterile Ziploc bag, he's again gonna remove any air that's in there. So at this point, he's done doing what he needs to do on his part. And then with me as a circulator, I can grab it. You always want a biohazard bag. He's gonna hand it off to me. I wanna make sure his labels are correct. Again, always verifying.
I'd probably put like 2 or 3 labels on if I had them, just to make sure that one falls off, you don't see it or whatever.
Do you
Once the
date
bone
it?
flaps off, do you keep that in saline on your table, or you could just
Yeah,
lay it on your back?
well, once, like, we'll keep it in saline until I get around to cleaning it, but then once it's wrapped up, we're gonna hand it off.
Yeah. Like I said, some surgeons may say before you store it, put it in betadine, bengo irrigation, saline. It's their preference. You asked me.
I said you date it, initial it.
Um,
I usually do, but I don't know if you just have to put it online.
So you-
I usually put it if I get it up at the tag, like the label, I'll put the birth date, MRN number, and the name.
Okay, I didn't know if you date the day that you got it too.
I never asked, I mean, I've never asked the scrub techs to do that, but what I do is, so he hands me the sterile Ziploc bag, and then me as a circulator, I store it in a biohazard bag again, removing any excess air. And then on the outside, I grab any paper. It could be an index card, it could be a computer paper, it doesn't matter what it is. I'll put the patient label, the date, and then I'll put the laterality of the bone flap. So let's just say this is a right bone flap. Here's your patient label. I'll put on the outside. So now at this point, this is ready to go. But before you have anybody send this to the freezer, you have to fill out your bone flap log. This log lives, which majority of you do know, it lives outside on the OR freezer. You can ask a PCA, you can run and grab it, anybody can grab it. I don't know if you guys want to pass this around, but you'd put your date, right bone flap, whatever side you're doing, patient label, always a patient label. Don't ever write the patient's name manually. You always need a label. This is helpful for track work. The surgeon, and it tells you what to write. The technician who packaged the bone, so I would write Eric Rivera. And then the time it was stored in the freezer. So normally if I text Maria and I say, hey, I have a bone, I'll write Maria, date and time. And that way she doesn't have to do it. Culture's done. I've been here for almost 8 years. I've probably seen cultures done maybe once. That's only if maybe it's infected, they want to do some culture swabs. It's very rare they even do that. So you would just write yes or no. And then now at this point, you're pretty much done with your paperwork. This can go back. Your bone flap log, and then the bone can be stored in our freezer. But please don't forget, and it happens, I get it, we're all in a rush, it's an emergency late at night. Always email either me, Joan, Barb, anybody, and let them know that a bone was stored in the freezer. You have to notify them so they can put it into tissue tracking with the blue. They have to create a blue label for it because it is a tissue. Once they get notified, they do write their initials and date and time when they received it. If you happen to forget to email, I'm always checking this anyways. If I don't see that Joan has put her initials on it, I know she probably was not notified, and that's okay. I'll let her know. And you have papers in this log. Anything that's blank, it's because their bone is still stored in our freezer. Like our oldest one is from 2022. So he's got a couple more years. Any questions so far? Okay. So let's just say a year goes by, John Smith is doing well. Now Dr. O'Rourke says he's ready to put his skull back on. So at this point, a tissue tracking label was already created. This has been in the freezer for about a year. Now we're ready to put it back on. I typically wait personally until the patient is intubated and asleep, because heaven forbid we open this up on the field and now case is canceled. And now we probably have to dispose of their bone, because I wouldn't want to rewrap it. So what I would do as a circulator, Eric is my scrub. Again, I will confirm with him with an MRN on the computer. We'll just double check, hey, this is John Smith, MRN, always confirming. So I'm gonna open it up. I will remove the Ziploc bag myself. Again, always checking, John Smith, this is who we have. Me as a circulator, all I need to do is unwrap the first outer layer. So I'm gonna try to open it up. Sometimes it's kind of sticky because when it's been in the freezer, it gets like frozen over. So just try to be careful. So I try to unwrap it until Eric can see the inner layer. And then he's gonna pull that sterilely.
So when I unwrap it, I'm gonna treat, once I get it unwrapped, I'm just gonna like put it on my, I'm gonna unwrap it on my table, like treat it like it's not sterile, change my gloves. That's how I kind of deal with it. So I'm gonna try to unwrap it the same way, you know, in a sterile fashion. But then I'm going to try to like place it on my table, and I'll change my gloves, just in case she touched something I didn't see it. That's how I deal with it.
And again, he's confirming as he's opening this, it says John Smith. And just like how they want it soaked in anything before we wrap it, same thing before we implant it back on the patient. Rabin likes betadine. Marlin likes his Vanco irrigation. Some just like saline. It all depends. It will say on their card what they want this soaked in prior to them reimplanting it onto our patient. If a bone does get removed for reimplantation, on the corner here, and I'll pass it around, it says date and time bone removed from freezer. So that's when I usually ask you guys just to put date and time and just say it was removed for reimplantation or removed for surgery, however you want to write it. Like you can see here, you can pass it along. Reimplantation, and then Natalie wrote date and time on that. If you guys want to pass that along. Now I know with Marcy, I wanted to go over, now any questions about packaging, storing, all that? Now just quickly with Marcy, I mean I could just go over it.
Yeah, I can't get the second screen up.
Okay. So anytime for us circulators, anytime you are putting the bone back on the patient, again, it's a tissue track, so you have to scan that blue barcode. And you have to keep that blue barcode for Charlene. What happens is when you scan it, because back then when we had the yellow barcode, if anyone remembers that, it was, you would scan it and patient information would pop up right away. Now with this new blue label and tissue tracker, when you scan that bone, it will come up and say, is this a one-time implant? So it'll look like it's never been entered into the system, but it has. So when that pops up, like is this a one-time supply, is this a one-time implant? Click on the one-time implant, and when you do that, all the patient information will pop up. Their MRN number, expiration. The only thing you would have to do is just build a name for it. There'll be no name. Usually I just say cranial bone flap. You can say autologous bone flap. Anything you can say that just says bone flap on there. Because I know that was a big problem that a lot of people were asking me. Like, I'm scanning it and nothing's coming up. It's giving me an error. You just have to click on one-time implant.
The reason why it's saying one-time bone implant or implant is because if at all we have a one-time, that automatically sends it to a report for our resource manager and materials management to see. And she's gonna see that this is autologous, and she's gonna know that it's a non-chargeable implant. So it's imperative that it is marked as a one-time implant. So it automatically comes up that way, so yes, it is a one-time implant, okay? the reasoning behind it is so that it goes to a prepared list for people to maintain so that they can see that it's not charging.
And usually with that blue sticker, like I said, always keep it, and again, put on a piece of paper, index card, keep that sticker along with the patient label, and you would put that paper in the TrackCore bin, like what we do with anything else that has tissue tracking. That way Charlene can keep track of that, because she also needs to document and review it and make sure that we documented it correctly. That was my spiel. Any questions? Yeah.
Actually, there's a few things I just want to talk about. When you're documenting the initial procedure, the initial case where you're removing the implant, the name of the procedure is a craniectomy, because basically you're removing and you're not replacing, as opposed to craniotomy. And the surgeon should tell you that. And of course, you should use the procedure that the surgeon tells you. Really, that's all you have to do as far as the name of the procedure. But if I were you, I would also create a nursing note that says that the cranial bone flap has been removed, that you used, St. Luke's policy to remove the flap and store it. I would also document, if cultures were taken in the rare instant that a surgeon did that. So feel free to put a nursing note in on the initial procedure where the cranial bone flap has been removed. I actually did a quick audit, and you have not been doing that, which is fine, I understand. But I think this wouldn't be a bad idea just to say that you're, using St. Luke's policy to use sterile technique to package and store correctly. The second procedure where you're putting it back, of course, the surgeon will usually choose a procedure that says just that, and maybe a little addendum in the procedure note that just says that you did a craniotomy with replacement of flap. That's really all that needs to be done for documentation of that. And once again, the implant information, which will go into the implant supply section.
Another thing too, real quick, is sometimes you get emergencies where they don't know the patient's name, so they come up with a random name, and that's your patient label, that's all you have, right? And then a year or two goes by, they finally are identified, and now when I look them up on the system, now they're Eric Rivera and not John Smith. So that when that happens and they finally come back to get their bone on, of course, they're gonna have old names on that bone. Of course, I will let you know, this is the patient. I usually update the patient label on there anyways, but you guys would be aware that yes, this is Eric Rivera, but you have a John Smith bone. That's happened very rarely, but it has happened where we've had two totally different names, but that's on me to, to make sure, keep up with that, and I would let you guys know.
So just to reiterate, you wait to the person's asleep. Is there a recommended thaw time for the flap?
Usually about 20 minutes, but by the time we get started, patient's asleep, we have more than enough time.
In sale
Yeah,
or
so
whatever?
you-
Yeah, whatever they
Yeah.
recommend, yeah. So,
I think the only time I ever did this, it wasn't wrapped like that.
yeah.
And sometimes it's really bloody, and sometimes the paper drape will stick to it. Sometimes I try to wipe it, kind of try to dry it up a little bit with a lap or something, just to make sure it's not so bloody. Yeah, so it doesn't stick. So when you're trying to unwrap it, you got papers sticking to it and everything. So.
And we're not doing any cultures before we're putting it back on.
I've never seen that done. I think usually if they wanted cultures, they would do it beforehand, yeah.
I think that is routinely done here.
It used
Yeah.
to, yeah. Probably used to get the swamps.
Yeah.
If you had to return it to the freezer, is there an okay amount of time that it can be out of the freezer before going back in?
Probably within that, I mean, I'm not sure, but I would say before thaws. But that's why I always wait till patient's asleep. Like Marlon will be like, bring the bone in. I tell him no, like I'm gonna wait,
Yeah.
because then it's
Yeah.
on me that I opened it. So, but like I said, you have more than enough time until, to let the bone thaw out by the time patient's intubated.
I have a question.
Yeah.
Do we ever store in the abdomen adipose?
No.
Just in case we ever get someone new and freaky, that is a different workflow.
Yeah, I've heard that, they put the
That
bone in the
was-
patient's abdomen.
I did that once.
Did you?
Like, like a long, long time ago. I haven't seen that. That was when I first started.
Yeah.
Orientation.
If the bone does get thrown out, if there's an abscess, it's infected, the surgeon doesn't wanna keep it at all, there's nothing you need to write on here, nothing at all. Just throw it out, you can make a nursing note, bone flap was, thrown away, per surgeon discretion, but there's nothing for that you need to fill out in here, because it's not being stored in the freezer.
What is the longest we've ever waited to reimplant? Do you know?
Probably 3-4 years. But usually by that point, although we can store it in 5 years, I don't think the surgeons like to always implant something that's that old, so normally we'll do a synthetic.
How do they get measurements for that synthetic? Do they take the flap out?
They get CT scan, they get CTs done, MRIs done, and then they pretty much form exactly what
They
they're,
don't use the one that's in the freezer.
correct, yeah, they'll use a synthetic.
No, I mean, they won't use the imprint. from the
No,
freezer.
no, they all get new scans, so.
Well, thank you, that was very helpful.
Everyone, where's that page? Oh,
Oh,
I'll take this. Thank you.